An Introduction to the NADA Protocol, Integrative Acupuncture in Addictions by Kenneth Carter, MD, MPH. Original article in the Journal of Addictions Nursing, Volume 25, Number 4, 2014. The National Acupuncture Detoxification Association, or NADA, protocol is a unique form of acupuncture. It specifically targets behavioral health, including addictions and co-occurring disorders. The protocol involves a bilateral insertion of 1 to 5 needles into predetermined points on each ear or auricle. People also use ear seeds, and research has found that these may be just as effective and helpful. The predetermined points on the ear are sympathetic, shenmen, kidney, liver, and lung points. These points have been shown to produce neurophysiologic, biochemical, endocrine, emotional, and cognitive effects. The NADA protocol is shown to reduce craving and withdrawal symptoms associated with addictive substance use. It is consistently and reliably associated with improving engagement and retention. This is not a standalone treatment. It is to be used in a comprehensive, integrated substance use treatment program that promotes symptom relief and improves treatment retention by relieving acute and chronic distress in persons seeking recovery. Cited from the Center for Substance Abuse Treatment, 2006. Now we use the term misuse. In addition, the NADA protocol is associated with a decrease in positive urine tests, increased program completion, improved patient satisfaction, and cost savings. The NADA protocol is a non-verbal, non-threatening intervention that has an immediate calming effect on patients regardless of the specific substance used and regardless of whether a coexisting psychiatric disorder has been diagnosed. Initial participation with the NADA protocol improves involvement in the treatment process. In most programs, patients receive the 5 bilateral ear points of the NADA protocol. The protocol can be easily and conveniently administered in small or large group settings. This safe, cost-effective, and cost-efficient procedure has gained increasing acceptance from agencies responsible for overseeing addiction treatment over the past 40 years. More than 500 state addiction programs in the United States use some form of acupuncture. Over 1,500 addictions programs worldwide use some form of acupuncture. NADA protocol acupuncture is increasingly integrated into dual diagnosis settings to help individuals with addiction and co-occurring disorders to better cope with a broad spectrum of behavioral health issues. As a balancing treatment, it is a universal benefit, regardless of substance of abuse in ameliorating dysphoric states such as depression, anxiety, anger, impaired concentration, decreased energy, and body aches or headaches. The origins of the NADA protocol. Lincoln Hospital, a city-owned facility in the impoverished South Bronx, launched the use of addictions acupuncture to address a public health crisis in the 1970s. Like today, the heroin epidemic of that time overwhelmed the capacity of the existing treatment system. What became to be known as the Lincoln model was inspired by the anecdotal findings of a Hong Kong neurosurgeon, 1973, who observed that electrical stimulation of the ear-lung point, or the vagus nerve, relieved opiate withdrawal symptoms. The Acupuncture Recovery Center subsequently discovered that simple manual needling produced a more prolonged effect and a reduction in cravings for alcohol as well as heroin. Shakur and Smith, 1979. Smith developed the NADA protocol, initially guided by acupuncture theory and acupuncture analgesia research. Empirical observations in a large public health clinic serving 200 to 300 patients daily led to the identification of the other 4 ear points in the NADA protocol. Thus, Shenmen, sympathetic, kidney, and liver were added to the original lung point. The lung is associated with grief, so there is also that. The functions of each of the 5 points are as follows. Sympathetic is related to disruption in both sympathetic and parasympathetic nervous systems. It has a strong analgesic and relaxant effect on internal organs as it dilates blood vessels. Shenmen regulates excitation and inhibition of the cerebral cortex and can produce sedation. Lung point is used for analgesia, sweating, and various respiratory conditions. Liver addresses symptoms associated with poor liver functioning and inflammation. Kidney is a strengthening point for the kidneys and can relieve mental weariness, fatigue, and headaches. Traditional Chinese theory associates the points with physical and physiological states. The lung is associated with the grieving process, and the liver is associated with resolving aggression, and the kidney is associated with willpower and coping with fear. Acupuncture points can be stimulated by various means: touch, movement, heat, and electricity, as well as needling. Health-related procedures such as acupressure, shiatsu, reiki, healing touch, and tai chi work on principles similar to acupuncture, although no needles are involved. Needling is a convenient and efficient means of stimulating acupuncture points. The acupuncture needles are inserted in the outer ear to a depth of about 1/8 of an inch and will penetrate cartilage if it is present in that location. Needles are twirled 180 degrees for smoother insertion. Notably, the arrangement of acupuncture points on the ear is similar to the arrangement of neurons in the motor cortex of the brain itself. A representation of the entire body is thus achieved and is understood as the homunculus, or microsystem, that both reflects and affects the body's state of health and disease. The ear is one such microsystem that is easily accessible. Thus, topographically, the outer ear can be represented artistically as an inverted fetus. It's very fascinating. NADA protocol's 5 needle points. NADA was established in 1985 to provide a more uniform approach to the treatment of patients and the training of practitioners using the Lincoln model. Reflected of this intention, the NADA mission statement is as follows. NADA stands for the National Acupuncture Detoxification Association. NADA, a not-for-profit training and advocacy organization, encourages community wellness through the use of a standardized auricular acupuncture protocol for behavioral health, including addictions, mental health, and disaster and emotional trauma. We work to improve access and effectiveness of care through promoting policies and practices which integrate NADA-style treatment with other Western behavioral health modalities. NADA provides a standardized training through the use of designated NADA registered trainers, or RTs. RTs reference the NADA Training Resource Manual 2010 to provide nationally recognized certification of training completion based on the acquisition of a shared set of core competencies. Upon completion of training, practitioners are certified as acupuncture detoxification specialists, ADSs. The NADA protocol for addictions was developed outside the traditional network of acupuncture colleges and universities. Most acupuncture schools do not provide training in the NADA protocol or addictions treatment. Acupuncture for addictions developed in grassroots community settings and in the trenches of public health addictions treatment programs. This is totally neglected nowadays. The NADA protocol was originally provided by anyone trained and certified as an ADS, regardless of professional status, which includes ADS without formal medical, nursing, or full-body acupuncture training. The NADA protocol is administered efficiently in a group setting. One ADS is able to treat a group of 15 to 20 persons over the course of a treatment hour. This modality can be integrated into any inpatient or outpatient addiction program at any stage of the recovery process to treat a wide range of troublesome complaints. It is also easily deployed in the aftermath of acute disaster and trauma. It expands access and removes barriers to care in individuals who are otherwise unlikely to receive it. It is important to emphasize that NADA protocol is standardized and uses a specific point combination that does not change. This provides the rationale for why it can be administered by unlicensed practitioners who do not have formal training in medical assessment or diagnosis. Patients may notice local effects such as warmth and tingling. Distal effects may include sensations of warmth or heaviness, although these experiences are more typical of body acupuncture than during ear acupuncture. Patients may feel sleepy during treatment. This reaction is part of the acute recovery process and passes readily. A few patients may develop a headache at the end of a treatment session. Shortening the length of the session or reducing the number of needling resolves this problem. Patients may have minimal bleeding after a needle is removed. Patients or staff may press a cotton swab to the site where the minimal bleeding has occurred. Postural hypotension is a rare needling reaction that may occur when needles are used. If this occurs, the patient will feel dizzy and lightheaded and may actually faint. When this occurs, the needles are removed and the patient is helped to lie on a flat surface. This will resolve in a few minutes and the patient will exhibit the typical relaxed behavior that often accompanies a full duration of treatment. Needling reactions occur more often in persons with a relative autonomic nervous system and in those unaccustomed to a relaxed state. Patients should be told to eat something before coming for treatment to reduce the possibility of a needling reaction.